Welcome to Maximize Living with Dr. Patrick Andersen. I'm Ellen Barrett and I'm really excited to be here today at Maximize Living. It's my first time coming in. I'm actually going to get a checkup today and we're going to check it out. It's all inside. Stay with us. We'll be back with more after the break. Hi. How are you?
I am good. How are you?
I'm doing well. I'm here to see Dr. Pat today.
You must be Ellen?
Yes.
Hi, nice to meet you. I'm Danny.
Nice to meet you as well.
Did you bring your paperwork in?
I did.
All right.
That's my patient history.
Okay, thank you. We do have a few other forms for you to fill out.
Sure.
And Dr. Pat will be up to see you.
Perfect. So excited. Awesome. Thanks. Hey, Dr.
Hi, Ellen.
Pat.
Welcome to our clinic.
I'm so excited to be here.
Oh, you're going to enjoy it. It's a fantastic field. You're going to really be excited about it.
Do you think you could give me a quick tour before we get started? Okay, perfect.
So along our front desk, we have all kinds of educational materials. Feel free to take that and help get more informed about probably the most misunderstood field in healthcare.
Sure, sure.
Over here, we have our New York Times best-selling books. We're very concerned about making sure we fully educate our patients on
I love that.
health and wellness.
It's important.
We do offer nutritional programs. We've got some awesome supplements that we offer to our patients, and we'll be going through more of that at another time.
Perfect. All sorts of different stuff.
And this right over here, we call our Wall of Fame.
Wow.
This is where celebrities and athletes who've had chiropractic care have made some pretty outstanding statements about how much it helped them.
I see Aaron Rodgers here.
Yep.
He's a fan. Tom Brady, Michael Jordan. Some really big names on here.
I've had the pleasure of taking care of several of them. But
very cool. Awesome.
And then right in this room, we call this area here, we call this our adjustatorium. This is where we do the spinal corrections that we call adjustments.
Perfect.
All right. And then you step over here. As we look up here, we have plaques of different organizations we've taken care of in Maximize Living, including USA Wrestling, the NFL Alumni Association, USA Weightlifting, USA Track and Field, and a host of others. And so many of these athletes just really rely on their chiropractic for their peak performance and recovery.
That's very impressive. Those are some really big names.
And then in this room here, this is where we do our explanation of what we found on your exam. It's very important to us that you fully understand everything on the exam because this is all new.
I love that. That's important.
And as we continue down the hall a little, we have an area here that we call our rehab area.
Okay.
And so many of our patients, we're giving specific exercises based on their exam and x-rays.
Sure.
So that they can rehabilitate properly, and it adds 30 to 40% of correction. We even have a number of home care procedures that we'll be going through later on what you can do to help your spine based on what we find on your case.
Now what's this stuff, Dr. Pat?
Well, this is where we do, there's a traction table, and we do specific therapies here to also help our patients.
Very cool. Can we get started?
Yes, come on in this room.
Okay. You guys have a beautiful space here. I love how open it is, very inviting, and doesn't feel like a regular clinic feeling.
Well,
feels very comfortable.
Yeah, it's very comfortable for patients to get checked here. It's kind of a family setting in a sense that a lot of families choose to use chiropractic care.
Sure, I love it.
So let me understand a little bit. You had written down that you have upper back pain.
Yeah, I can really feel it when I sit at the computer all day at work, which I'm sure a lot of people can relate to, and just a general tightness, and when I tend to get stressed, I can feel it in my shoulders.
And how long has that been going on?
Probably for a very long time.
Like forever?
Like forever.
Do you remember any time that first started it?
I think just, you know, going into my career, and you tend to sit at your computer for long periods of time, and bad posture.
Do you feel like you slump a lot?
I think I do at the computer, definitely.
Yeah. How about when you're walking and moving? Do you feel like you walk well with good posture?
I try to, but I do think I tend to curve my shoulders a little bit.
We'll check that. Now, do you get any arm numbness or aching or pain?
Nope.
Or any headaches, things like that?
No, very infrequently.
Okay. Low back pain or leg pain, anything along that line?
No.
Okay. Well, good. We'll start our exam next.
Oh, I'm super excited. Stay with us. I'm really excited to see what Dr. Pat has to say, and we'll have more Maximize Living coming up after this.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Email Dr. Pat at cw57.tv.
Welcome back to Maximize Living. I'm here now with Dr. Pat. I just got an awesome tour of the facility. We're going to get started with our exam.
Yeah.
I'm excited. Okay, what do I need to do?
Stand right over here if you would. These are bilateral scales, 1 foot on each side, and then look straight ahead. And while those scales are measuring, I'm going to take a look at your posture here.
Sure.
Okay. We have a right head tilt, like that. High left shoulder, and forward shoulder on the left.
I can feel myself trying to stand straight up.
Well, that makes sense with the pain that you get up there.
Yeah, I just feel a lot of tightness in my shoulders.
And then right in here, this area is pushed forward. We call those anterior dorsals. Is that tender here at all?
A little bit. Yeah, right there.
Right there, that one right there, isn't it? So, Danny, we are plus 10 on the left. And then let's take a look at the lower back posture.
Okay.
Right lumbosacral angle. And then forward head posture and some roundness of the shoulders forward. And Danny, the lumbar spine appears forward as well. And if you would, step right back here. Ellen will take you through some orthopedic tests and range of motion. So face that way for me. And I'll lean you to the left. Tell me if this causes any discomfort or pain.
I heard it crack.
I don't like that. 20-20. Rotating. Does this hurt at all?
Nope.
And loading down.
Nope.
30. 30 and loading down. Any pain? If people have back pain, that'll often hurt.
Okay.
If they have a back lumbar area. Bend forward as far as you can, like you're touching your toes. Any pain doing that?
Nope.
Okay, we're at 90 degrees. Lean backwards. Does that cause any pain?
Nope.
Okay, 30 degrees extension. Have a seat right here.
Okay.
Facing this way. And tell me if this causes any pain. Going sideways.
No pain, just tightness. Ooh,
Okay.
and a crack.
Yeah, that crepitus means something's not quite right in your neck when it does that.
Is that the official name for cracking?
Yes. And positive maximum, or positive shoulder depressor bilaterally. And let's do this one and this one. Any pain on those?
Nope.
Max C compression normal bilateral. Turn your face this way as far as you can. 80 right. Turn left as far as you can. Can you go any further? A little tight on that one?
A little bit.
75 with tightness. Head forward as far as you can. Does that cause any pain?
No, just tight.
Do you feel it down here at all, or do you feel it tight in the neck?
Mainly in my neck.
Okay, 60 with neck tightness. Head all the way back. Does that hurt when I load it a little? Okay, good. 50 on extension. Let's do your side bends. 40 left. And that one's tighter, isn't it?
A little bit, yeah.
Yeah, 35 with tightness. It didn't move quite the same.
That's so
That's
funny.
what we find when we examine people. Most people don't know they have this going on until they actually get a checkup.
Well, so often, you know, we stretch and we're not really thinking about how it feels when we stretch.
Yeah.
And maybe we do feel a little bit of tightness or something like that.
Now, if you would, lie flat on your back.
Okay.
And I'm going to check your leg length.
Okay.
Even leg length, so that's a good sign.
Good.
Now we'll check hamstring flexibility. So she's good 80 degrees. Excellent. Now we're going to check psoas hip strength.
Okay.
Don't let me push down. Hold as hard as you can.
Ooh, that's tough.
That's a little harder. I'll give her about a 4.9 on the right psoas. Hold here. Don't let me push in. 5.0 on the right TFL. This is a good 80 degrees on hamstring. Check the psoas strength. 5.0 on left psoas. Hold here. Don't let me push in. 5.0 on TFL strength. Hold your legs 6 inches high. Does that cause any back pain?
Nope, just abs.
Okay. And normal Milgrams. Hold right here.
Okay.
Don't let me push in.
Ooh, that's hard.
Hold as hard as you can. So there's definitely a 4.5 on supraspinatus strength. That your shoulder has some issues, most likely with that.
Sure.
Is that sore right here?
It's tender, yeah.
Yeah. And let's just check this one.
Okay.
Okay, so we'll be taking a closer look at that shoulder.
What a big difference.
Tell me if this bothers your shoulder. Mm-mm. Or this. Or this.
Just tightness, I think, on the inside on that last one.
It looks like rotator cuff impingement.
Okay.
Hold, don't let me pull down and out. That's good. Punch up. Hold. And bend your elbow. Don't let me push down. Okay, those are all fine.
Okay.
Now raise your head, turn to the side, and don't let me push down. 5-0. And 5-0 bilaterally on cervical flexors.
Perfect.
All right, now I'm going to ask you to lie face down.
Okay. We're going to take a quick break, but stay with us, and we've got more from our exam coming up next.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv.
Welcome back to Maximize Living. I'm getting an exam right now, and we're going to finish it up. What do I need to do next, Dr.
Lie
Pat?
face down, please, Ellen. I'll start by checking your leg length in this position. Here we see a short leg on the right, and it gets longer. That tells me pelvic rotation, actually.
Okay.
PD right. And tell me if this bothers your lower back
Nope.
or knees. Normal necklace. Does this bother you at all doing this way
Nope.
or this way?
Nope.
Hips is normal. Raise this leg as high as you can. Does that cause any discomfort?
Nope.
Now kind of give the table a bear hug.
Okay.
Hold on, and I'm going to have you hold your leg right up in the air. Don't let me push down. 5-0 on the left gluteus maximus. Raise this one up. Does this cause any pain?
Mm-mm.
Hold right there. Don't let me push. 5-0 on the right gluteus maximus. Now, and I'm going to palpate. There's a great spot for your hands right down here.
Oh, perfect.
Right there, all padded for you.
That's nice.
Relaxes your shoulders while I test you. Tell me if this hurts.
It's a little tender.
Yeah, L5 percussion pain. How about this one?
That one doesn't feel as tender, no.
Okay, those are pretty good. Yeah, right in here we have issue right there. We saw
Tender.
that before. All right, tell me if you're sore in the sacroiliac joints.
Nope.
How about in the gluteus medius muscles in here?
Nope. Ooh, maybe a little bit right there.
Both sides?
Yeah.
Gluteus medius trigger points, left and right. Is this tender as I get into these erector spinae muscles?
Not really, no.
Okay, good. Ellen, are those tender as we get into these trapezius muscles?
Yes, definitely.
Trigger points bilateral on the trap. And how about across the base of the skull?
Yeah, that's very tender.
Right there. And how about right up in here?
Yep.
Okay, it's bilateral suboccipital trigger points. Go ahead and sit up for me now, Ellen.
Okay.
Now, based on what we found on your exam and the symptoms you're having, I do recommend that we take x-rays.
Okay, perfect. Well, I'm going to get ready for those. Stay with us and we'll be back with more.
All right, Ellen, if you would, just have a seat right here.
Okay.
Feet up on the stand. And sit up nice and tall for me. We'll get this. So just right, head back. We'll tighten these, make sure we have you centered. All right, right like that. Open your mouth as wide as you can. Anytime you're ready, sorry about that. Step to the right, hold it right like that. Step forward about an inch. Perfect, right there. Step to the right a little bit more. Good, right there. All right, touch your belly button with one finger. Good. All right, arms down. And good, right there.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Email Dr. Pat at cw57.tv.
Welcome back to Maximize Living with Dr. Patrick Andersen, and I'm super excited to be here because I'm going to get my first adjustment.
Yes.
It's great to see you, Dr.
Yeah,
Pat.
it's great to see you too, Ellen. Welcome back.
I'm really excited.
Yes. Well, I want to go through what I found on you.
Okay.
And so I think I found why you're having the pain you're getting in your upper back and the tightness you've had for almost forever.
Okay, I'm not imagining it.
No,
Okay.
you're not imagining it. We saw it on your exam and your x-rays. One of the problems is you have forward head posture. It was 38 millimeters. And that's like
Wow.
wearing a 12-pound hat all day long.
Well, that makes sense then that
Yeah,
I'm
put
having
pressure
some
on here, 'cause your
pain.
head being forward is really hard on your neck.
Okay.
We also saw that you don't have the normal curve in your neck. It's actually a kyphotic curve in the lower neck.
Okay.
So that reverses the normal curve, and that creates a lot more tension in your neck and back and interferes with those nerves,
Gotcha.
causing issues over time. And then when we look at your lower back, we really saw your pelvis was twisted
Sure.
and low on the right side. So those are big factors. I know it's just tender in the low back, and the muscles are tight, but those can bother you down the road if we don't get that taken care of. So when we looked at your exam, we also found a high shoulder on the left. We saw tight muscles in the neck and the skull, base of the skull and the shoulders, and weak muscles in the shoulder. So we do have some impingement syndrome going on in this right shoulder.
Yeah,
so
I could feel
we have
that.
adjustments for that as well.
Perfect.
So what I'll do is a light adjustment. You'll feel a little shifting as I do it. Doesn't really hurt.
Sure.
And it just sounds a little surprising. And then it's very safe. The likelihood of an injury from chiropractic care is about 1 in 500,000 for anything
Wow.
significant. And I see no major contraindications to adjusting it.
Perfect. Let's
All
do
right.
it.
So lie face down for me.
Okay.
I'll start with a drop table technique. This will help with the hip alignment. It's twisted. It's as simple as that, using the force of the table to set that. And then I want you to turn your head to the left for me. And the light force right here, relax as best you can. Just like that.
Easy.
And lie on your back for me.
Okay.
Very nice and light adjustment right here. Turn your head this way and relax your head. Just like that. And now we're gonna see if you're still weak on your right shoulder.
Sure.
Hold as hard as you can. And you are. So I'm gonna do a decompressive adjustment. And hold there. Don't let me push. See the difference in your strength?
Yeah.
So
That's a
that
big
opened up that
difference.
joint space so the muscle could work better.
Wow.
All right, Ellen, go ahead and stand right up. We
Okay.
have our last adjustment right here. This is for that one that's tender in your mid-back.
Sure.
So stand with your back right against there.
Okay.
Cross your arms like this. Head down like this. I'll do a light force lifting that anterior. Right,
Oh
like
my
that.
goodness.
It
That
didn't take much force.
Felt pretty wonderful.
Yeah. Often people will breathe easier,
Yeah.
stand taller, move easier, and sleep better, and even have a euphoric sense after an adjustment because it stimulates so many of the endorphins in the body.
That's the exact word I was going to use actually for how it kind of feels when you get up after being adjusted.
Yeah, there's nothing like it.
Wonderful.
So welcome to your first adjustment.
Thank you so
Now,
much.
We'll take you up front and we'll get you scheduled for what we call our doctor's report, where we'll
Perfect.
get you to actually understand your x-rays and your exam findings and give you our best recommendations.
Wonderful.
Well, Danny, Ellen had our first adjustment today.
This is wonderful.
Her strength is stronger in her shoulder already, and we have moved really well, so happy with that. Would you please get her set up for her doctor's report?
Certainly.
Ellen, welcome to the clinic.
Thank you so
Enjoy
much
that
for having
adjustment.
me today. It was such a wonderful experience, and I immediately feel like I'm standing taller and in
That's
less
great.
pain, which
That's
is great.
Can't wait to show you everything we found tomorrow.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Email Dr. Pat at cw57.tv.
Thank you so much for joining us today for Maximize Living with Dr. Patrick Andersen. I was so excited to have my first adjustment, and I came back again, checked out my x-rays, and I've got some homework to do. So we'll catch you next time right here on Wisconsin's 57 Television.